हेलो डियर फ्रेंड्स। हमारी जो नो सोर्ट्स की जो ये सीरीज चल रही है, इसमें हमने इंडिकेशंस ऑफ नो सोर्ट्स, प्रिकॉशंस ऑफ नो सोर्ट्स और सिफलाइनम को डिस्कस किया था। आज जो हमारा टॉपिक है डिस्कशन का वो है गोल्डन रूल्स and special forms of prescribing. Golden rules and special form of prescribing. There are different types of prescribing we have. So we have epidemic prescribing. We have preventive prescribing. We have retrospective prescribing. We have intrauterine prescribing. We have prescribing for birth trauma, lesional prescribing, and zigzag prescribing. These few types of prescribings we have. So a few months before, we all suffer from one epidemic disease, that is COVID, and 100 millions of people dies in this crisis. And that epidemic conditions, Dr. Hahnemann gave us a special form of prescribing, that is genus epidemicus. So this type of catastrophes will come in future too, so we have to prepare ourselves before indulging these crises again. So first is epidemic prescribing. An epidemic could be considered a mass expressions of an acute miasm affecting a large number of people. Homeopathy is very successful in epidemic prescribing, whether for a known illness such as measles or for an unknown one, as it is termed in allopathic medicine when the microbes has not yet been isolated. A classic example of an unknown microbes was the first epidemic outbreak of chronic fatigue and immune dysfunction syndrome in California in 1981. If we talk about America, Canada, in Western countries, there are lots of epidemic diseases people suffer from. And the first one was chronic fatigue and immune dysfunction syndrome that was happened in California in 1981. Even when the pathogen is isolated, as in the recent hantavirus epidemic, modern medicine is helpless to prevent the spread until the vaccine has been developed. The same condition is occurred in 2020 when COVID started. And when COVID started, modern medicine has no answer until they develop a vaccine, which is difficult, costly, and not always effective, especially against virus. That they developed many vaccines. They did lots of research work on it, but there are lots of side effects occur because of that vaccine. If Hahnemann had done nothing else except treat the great epidemics of his era, he should still be considered one of the greatest healers of all time. Because only the Hahnemann who treat lots of cases with homeopathy. In his lesser writing of von Bonninghausen gave us Hahnemann's prescriptions for the cure of Asiatic cholera. The chief remedy is camphor, and not one out of 100 patients would have died if camphor alone would have been used and used immediately at the start. For it is only so useful if used alone and at the beginning of the disease. Therefore, everyone must use camphor at once as soon as any of his family is taken ill with cholera, and must not wait for the help of the physician. डॉक्टर वॉन बॉनिंगहसन ने इस एपिडेमिक के दौरान सभी से ये कहा था, क्योंकि कैम्फर उस टाइम एक वैल्यूएबल रेमेडी थी, इसको इस्तेमाल किया गया, और उन्होंने कहा कि अगर किसी को भी इस तरह के साइन पैदा होते हैं तो वो इस मेडिसिन का इस्तेमाल करे, एक्सेप्ट कि वो किसी फिजिशियन का वेट करे. So and must not wait for the help of physician, which though it might be good, would yet be too late. If there is not very soon a striking improvement, we must not hesitate a moment to at once proceed to the remedy for second stage, that is 2 or 3 pellet of refined copper. This is Cuprum metallicum. A like good effect will be obtained from white hellebore, Veratrum album in 4th potency, but the preparations of copper is far preferable and more effective. तो उस टाइम में 18th सेंचुरी में 3 दवाइयों का इस्तेमाल किया गया. फर्स्ट कैम्फर. उन्होंने कहा कि अगर कैम्फर नहीं काम कर रही, कोई भी इफेक्ट नहीं आ रहा, तो नेक्स्ट रेमेडी जो है वो क्यूप्रम मेटालिकम, और जो थर्ड रेमेडी थी वो थी वेरेट्रम एल्बम, जिसका इस्तेमाल एशियाटिक कॉलेरा में किया गया. एंड he brought relief to thousands of children striking with scarlet fever. डॉक्टर हैनेमन ने इस दौरान बहुत सारे स्कारलेट फीवर के जो पेशेंट थे उनको ठीक किया. एंड द रेमेडी वाज बेलाडोना. इन स्कारलेट फीवर दे यूज बेलाडोना. He saved Napoleon army from typhoid fever with 2 remedy of that epidemic, Bryennia and Rostox. And he cured Asiatic cholera that ravaged Europe in 1831, whereas more than 50% of patients treated with allopathic measure died from the cholera. And note that Hahnemann had already figured out the cholera remedy from accounts he heard from Eastern Europe. By the time his plague hit Germany, Hahnemann could advise his patient what to take preventively, saving thousands of lives. And this feat alone should have given him eternal praise, but alas, his jealous colleague prosecuted him even more. उसने बहुत अच्छा काम किया, बहुत प्रैक्टिकल काम किया, बहुत सारी जानें बचाई. कितनी ज्यादा एपिडेमिक्स जर्मनी में, यूरोप में, बहुत सारी कैटास्ट्रॉफीज आई, बट डॉक्टर हैनीमन ने इन सभी कंडीशन का पूरे कॉन्फिडेंस से सामना किया और बहुत सारी जानें बचाई विद द हेल्प ऑफ कैम्फर, क्यूप्रम, बेलाडोना, वेटरन एल्बम, Rustox, Brinia. They use these remedies as a preventive measure. And even Dr. Hahnemann get good ground rules for epidemic prescribing in aphorism number 100 and 102. 100, 101 and 102. He described the treatment of epidemics in organon of medicine. That's why organon of medicine is much more important than materia medica and repertory. Because if you don't have a manual, you can't use these materia medicas and repertory in proper ways. You can suppress, you can destroy the internal peace of patient. He says, in the investigation of the symptom, in aphorism number 100, in the investigation of symptom complex of epidemic or sporadic diseases, जब भी आप एपिडेमिक या स्पोरेडिक डिजीजेस की इन्वेस्टिगेशन, उसके सिम्टम की इन्वेस्टिगेशन करेंगे, इट मेक नो डिफरेंस इफ समथिंग सिमिलर हैज एवर अपीयर बिफोर. तो उससे पहले की जो एपिडेमिक आई थी और अब की जो एपिडेमिक आई है उसमें कोई ज्यादा फर्क नहीं होगा. सेम एज इट इज ही वो आएगी. Each waning epidemics greatly from all former epidemic. जो सिमिलर कंडीशन आई हैं वो जो पहले एपिडेमिक आई थी उसके से कोई ज्यादा फर्क नहीं होगा, उसी तरह की होगी. विच हैव बीन फॉल्सली लेबल्ड विद सर्टन नेम, जिनका अलग अलग नाम दे दिया गया. प्लेग आ गई, उसके बाद एशिक कॉलेरा आ गई, स्वाइन फ्लू आ गया, यहां कोविड आ गया, बट दे इफेक्ट द ह्यूमैनिटी इन द सेम वे. दिस इज ट्रू ऑफ ऑल कंटेजियस डिजीजेस एक्सेप्ट, सिमिलर है, ज्यादातर बिल्कुल सेम है, सिमिलर है, एक्सेप्ट those that stem from a invariable infection standards such as smallpox, measles. ये इनसे थोड़ी सी अलग है. This is the rule, this is the truth of all contagious disease. COVID, swine flu, they affect the immunity in the same way. And it may well be that the physician does not get a perception of the complete image of the epidemic disease with the first case he encounters, since each such collective disease only bring the complex of its symptoms to the light of day with the closer observations of several cases. एक केस को ही देखकर कभी भी कोई भी होम्योपैथिक फिजिशियन उस एपिडेमिक की पूरी पिक्चर को समझ नहीं सकता. इसलिए उसको हजारों केस देखने होंगे ताकि वो उसकी पूरी कंप्लीट पिक्चर को देख सके. आई गिव यू अ सिंपल एग्जांपल. आई नो 2 colleagues, they suffer from epidemic, the COVID infection. One person, when the first person is infected, on the third day he got fever. After that, after getting the fever, he start coughing, and fifth day he has a problem in breathing problem. Their oxygen level goes down, कम हो गया. Second person who has the same condition, third day fever, and fifth day he got dry cough. When he got the dry cough, on 8th day he has a bleeding through mouth, and 10th day there is no taste of tongue. In 15 days that second person lose 20 kilograms of weight because of tasteless tongue. He didn't eat anything, and the 15th day he just eat one orange per day because he has a taste of orange. So after 21st day, the second person has a blood clot in chest and in calf muscles, and the first person has lung problem. He lost his 30% of lung. Same infection, both person has a different symptom. One person has lungs involvement, just a lung parenchyma destruction, and oxygen levels goes down, and the second person has good oxygen level but has a dry cough plus blood clots. So that is why Hahnemann says you cannot decide the whole picture of the epidemic diseases in one case. It may be well that the physician does not get a perception of a complete image of the epidemic disease with the first case he encountered, since each and such collective disease only bring the complex of its symptoms to the light of day with the closer observation of several cases. जब तक वो हजारों केस को क्लोजली ऑब्जर्व नहीं करेगा, फिजिकल लेवल, मेंटल लेवल, इमोशनल लेवल, तब तक उस डिजीज की कंप्लीट पिक्चर को नहीं उतारा जा सकता. That's why we lost lots of doctors too, even homeopath, because they don't know the complete picture of the disease. So meanwhile, the carefully investigation physician can often come to close to the true state. इसी दौरान जब वो केसेस को दोबारा देखेगा, उसी दौरान वो उसकी ट्रू स्टेट, जो एक्चुअल स्टेट है, उसके नजदीक पहुंच पाएगा. Even with the first or second patient, that he become alive to the characteristic image of the disease, then find a fitting homeopathically commensurate, that is qualitative remedy for it. क्योंकि कुछ केसेस में आपको उसके जो एग्जैक्ट सिम्टम हैं, क्योंकि उसकी ट्रू नेचर तो बहुत आगे जाकर आपको पता चलेगी, मगर उसके जो कैरेक्टरिस्टिक सिम्टम, जैसे फीवर, जैसे कोविड है, उसमें सबसे पहले फीवर था, फीवर के साथ ड्राई कफ थी, ड्राई कफ के साथ टेस्टलेस टंग, ये इसके कुछ कॉमन कैरेक्टर थे. जीभ का टेस्ट चला गया, खाने की भूख मर गई, वेट लॉस हो रहा है, लंग इन्फेक्शन आ रहा है, ऑक्सीजन का लेवल डाउन जा रहा है. दिस काइंड ऑफ सिचुएशन we face during this epidemic. But this epidemic is not different from the epidemics we already faced in our past. Same. But we failed. Yes, it's true. We failed to collaborate. We failed to judge the true nature of the disease because of organ of we didn't read, we didn't know the exact value of organ of medicine. If one doctor understand the value of this epidemic diseases which described by Dr. Hahnemann, we can easily find out the exact remedy. So the entire extent of such an epidemic diseases, the totality of its symptom cannot be perceived in a single patient, but can only be completely abstracted and gathered from suffering of several patients of different bodily constitution. अलग अलग कॉन्स्टिट्यूशन का अलग अलग करेक्टर होगा, अलग अलग करेक्टर के अलग अलग सिम्टम होंगे और अलग अलग सिम्टम्स में अलग अलग मेडिसिन आपको नजर आएगी. For the classic yearly flu epidemic, allopathic medicine can only make a vaccine from the previously known virus strain, which of course will not work if the current virus is different or has mutated, has frequently happened. और हमारी कोविड में क्या हुआ है? There are 5 phases. We face 5 phases in Canada. इसके 5 phases आए. 5 phases में different symptom थे, अलग अलग symptom थे. 5 phases में जो age का फैक्टर था वो डिफरेंट हो गया. 5 phases में बूढ़ों से लेकर बच्चों के अंदर सिम्टम अलग थे, लेडीज में अलग थे, बच्चों में अलग थे, ओल्ड एज में अलग थे. That's why we have to know the phases too. किस तरह से वो जो डिजीज है, किस तरह से उसके अंदर बदलाव आ रहे हैं. This is important. Despite of possibility of side effects, vaccines is still encouraged for the weakest members of our society, children, the elders and the chronically ill. जो पहले से बीमार थे, already उनको पता था कि there are lots of troubles, there are lots of side effects we will face when we prescribe these vaccines. But they prescribe that vaccines, and after that children's, elderly people or chronically ill patient, we lots of people. For the homeopath, prescribing for a new flu variety is simple. If somebody know every single word of organum, he know the provings, because nowadays nobody reading the proving, the textbook of homeopathy. I know one person, just one person, Dr. Alam Khan, he know the value, but I didn't see any other person who read the proving textbook. For the homeopath, prescribing for a new flu variety is simple. After seeing 10 to 20 cases, he record the symptom common to the patient. 10-20 पेशेंट देखने के बाद आपके पास एक डाटा आएगा और आप उस डाटा में देखेंगे कि कौन से सिम्टम जो हैं वो कॉमन है पेशेंट के लिए, एंड दीज आर द कार्डिनल सिम्टम ऑफ एपिडेमिक. पेशेंट में 20-30 पेशेंट देखने के बाद आपको ये अंदाजा हो जाएगा कि कौन से सिम्टम जो हैं वो कॉमन आ रहे हैं। फीवर आ गया, ड्राई कफ थी, लॉस्ट ऑफ टेस्ट था, ऑक्सीजन का लेवल डाउन जा रहा है, लंग्स की इन्वॉल्वमेंट हो रही है। These are the common symptoms of disease. And these are the cardinal symptoms of the epidemic. The basis of selecting the remedy, और यही एक बेस बनता जिससे कि हम किसी एक सिंगल रेमेडी तक पहुंच पाते हैं। Sometimes he find that one group of patients have one clear symptom picture and indicated one remedy, and another group need another remedy. This is possible कि एक ग्रुप में, जैसे कि मैंने अभी आपके साथ डिस्कस किया, डिफरेंट पेशेंट में डिफरेंट सिम्टम्स आए, तो डिफरेंट सिम्टम्स में डिफरेंट रेमेडी हमें देखने को मिलती। And I have never needed more than 2 remedies for a given flu epidemic. Sometimes there is one main remedy, 1 or 2 minor remedies, and these main remedies for an epidemic is called genus epidemicus. You see 20-30 patients, you find out these are the common symptom of the patient which is present in every case. These are the cardinal symptom of the disease, and after that you select the group which have same symptom, another group have a different symptom, both have different remedy, and after that you find out one main remedy and 2 or 3 are minor remedies, and the main remedy is called genus epidemicus. For example, the swine flu in 1980 responded mainly with Baptisia. Spanish flu 1918 responded mainly to Baptisia, while Beijing flu in 1993 and 1994 responded with the Gelsemium first, then after that Bryennia and Calibi. These remedies help my patients overcome this fearsome flu strain in 2 or 3 days. And while others were in bed for 3 to 4 weeks on a fertile course of antibiotics after another. So if there is 2 remedies, it would be easy to create a simple differential diagnosis so that anyone, nurse, patient, public health worker could tell which to give. So if we are dealing with these kind of situation, don't hesitate to give information to your colleague, क्योंकि ईगो क्लैश होती है और हम किसी को कुछ नहीं बताते, even in our system. So don't hesitate to give information to your colleague, your society. Differential diagnose, tell them everyone. For example, if the 2 remedies are Bryennia and Pulsatilla, the differential diagnosis would be follow. If the patient has high fever, thirsty, Bryennia. If the patient is low fever, thirstless, is Pulsatilla. This is differential diagnosis. And if the symptoms are matched, you can prescribe the remedy. It will help. Does Oscillococcinum work? The homeopathic remedy is the top selling flu remedy in France and is now widely available in this country. Some classic homeopath says that the routine prescribing is suppressive. And on the other hand, others have seen it's better provided it is given early enough and it must be given right at the onset, and it work better for the flu characterized by muscle pain, fever, rather than stomach flu or flu with head cold. In that situation, gelsemium is the remedy. So this is the first prescribing, and everything is given by Dr. Hahnemann. Aphorism number 100, 101, and 102. I know this is a boring topic for many of the people, because they don't want to waste their time in reading Organon, because they know the materia medica and repertory as well. But according to me, when there is lot catastrophic come in your house, then we should know how we can deal with. जब भी हमारे सामने इस तरह की कोई सिचुएशन आती है, तो हमारे हाथ सबसे पहले खड़े हो जाते हैं, क्योंकि हमें इन सभी चीजों के बारे में पता नहीं होता, और ग्राउंड लेवल पर बेसिक चीजें हैं ये, और ये बेसिक चीजों को याद रखना, क्योंकि कोई एक डॉक्टर के लिए कोई वर्स्ट से वर्स्ट सिचुएशन कभी भी पैदा हो सकती है. सो वी शुड नो हाउ टू डील विद दिस काइंड ऑफ सिचुएशन. दिस इज एपिडेमिक प्रिस्क्राइबिंग. और ये टॉपिक मेरे लिए इसलिए भी था क्योंकि I saw lots of patients who died with this epidemic, because there is no treatment at all. No treatment. So it may help us, or next time maybe, कि अगर हमें इस तरह की सिचुएशन फिर दोबारा से मिलती है, तो हम इसके लिए पहले ही प्रिपेयर हो जाएं, ताकि हम उसकी एक ड्राइंग, एक पिक्चर बना लें, ताकि आने वाले टाइम में ये हमें हेल्प कर सके. सो दिस इज एपिडेमिक प्रिस्क्राइबिंग. इफ एनी क्वेश्चंस रिगार्डिंग दिस प्रिस्क्राइबिंग, प्लीज आस्क. वी विल डिस्कस इन नेक्स्ट lecture. Thank you.